Namaste. Hello. Good evening. Myself DrJalpa Bhatt. I am working as a gynecologist and professor. Today I am recording this video to help you learn instruments which are used in obstetrics and gynecology. The first instrument is a swab holding forceps. As you know, any instrument has three parts: blade, joint and handles. And handles are having catch, clamp and crush. So this instrument is known as swab holding forceps. We hold swab here and we start painting the patient. We start painting from the incision line. So we start painting, we go away. The first thing we used for painting is betadine and then we use spirit. We can also do painting by using the Savlon first, cleaning it, followed by betadine and spirit. Once the patient is painted properly, then patient is draped. Now let us see how to hold any instrument. We have to use our third finger and thumb like this. The second finger will support and first finger will support here. So that is how we hold any instrument. And suppose any long instrument and we want to support it, then we can support it here. Right. How to identify swab holder? Swab holder has a fenestrated, there is a hole and fenestra, right, on the inner aspect, so that it can hold the swab holder in a proper position. The box joint and the handles, these are the towel clips. After we paint, we drape the patient, and to keep the drapes in their proper position, we are using towel clips. Towel clips have pointed needle-like blades, right? Because they are used to keep the drapes in place. Once we do painting, then we drape the surgical site, and these are used to keep the drapes in the place. Remember, there should not be, with the drape, skin should not be included. Otherwise, these needle-like blades may injure the skin. They also are having catches and a small handle. So these are the towel clips. Once the patient is painted and wrapped, we want to put incision. How do we put incision? With the knife. We should hold knife in a pan holding manner. The knife has two numbers. As you can see, this is a 4 number, and also we can have knife which is having a 3 number. Right? Okay. For Incision we use 4 number knife and we use 21 number or 22 number blade. So this is a blade. It is to be given in a sterile manner. We open it, right? We open like this. Then we hold the blade, right? Enter it. There are grooves on the side of the handle, so we just enter it and it fits, right? This is a 11 number blade, goes over the 3 number handle, and the 22 number blade goes over the 4 number of the handle, right? So this much can be asked for a knife handle and knife. Next, once we have put the incision, we have to catch the bleeder in the subcutaneous tissues. So we catch the bleeder by this instrument. This is known as artery forceps. Again, this instrument has blades, joint, handle, catches, clamp and crush. 3 catches. The artery forceps can be of different size. It can be straight or curved. This is a mosquito artery forceps. Can you see the difference between the 3? Yes, there is a difference in the length, difference in the length of the blades, difference in the length of handles also. Again, this instrument also to be held in a similar manner, and we catch the bleeding. We can hold the soft structures also with the artery forceps like peritoneum. Now to hold the sheath, we need to use Allis forceps. See the Allis forceps. Here the blades are little bit curved at the tip and they are having teeth. So this is a Allis forceps. You have to differentiate it with many other instruments, but in the exams you are asked mainly to differentiate the Allis forceps, long Allis forceps with the valsellum. It is curved, these are straight, right, and uses are also different. We'll come over the valsellum part, but this is the Allis forceps. Again, this is a long Allis forceps and this is a short Allis forceps. Allis forceps is used to hold tough structures like skin, sheath. Then comes the scissors. Once we hold the sheath with the Allis forceps, we cut the sheath or extend the incision over the stick till the abdominal skin incision. So we need to use scissors. I have a separate video over the scissors you can see on my channel, but still I would like to show you some scissors. These are the Metzenbaum scissors. These are the curved scissor. These are also curved scissor but stout scissor, and this is a straight scissor mainly used for suture cutting, right? And these are two scissors are used for tissue cutting. Remember, scissors do not have catches, right? That is a difference from other instrument. Scissors do not have catches. We hold the scissors in a same manner as we use other instruments. Fine. Once you cut with the scissors the sheath, then we open the peritoneum held with artery forceps. Once we enter, we have to retract the bladder, and for retraction we use retractors. Retractors basically have three functions: retraction, protection of the structures which are lying beneath it, and they reflect the light in the operative field. Fine. So these are Doyen's retractor. We have other retractors also like Morris retractor. See the difference? Morris retractor has little bit square and Doyen's retractor is curved and it is given curves on this side, and side to side curve is also there, and there is no groove. Okay, how to hold a retractor? We don't have to pull so that the structures are damaged. We just have to adjust it and just hold it. Do not give much force over the okay. Retractors are useful in gynec surgeries also, like abdominal hysterectomy, ovarian cyst removal, abdominal myomectomy surgery. And once we open the uterus with the help of the knife. Liquor comes and we deliver the baby out. We remove the placenta. To hold the placenta, we have to use straight clamps, right? So these are the straight clamps which look separate from the artery forceps, right? So these are the straight clamps by which we clamp the cord and cut the cord. We cut the cord with a different scissor. These scissors are known as cord cutting scissors. They have a short rounded blades, small joint, again small handles, and there are no catches as like other scissors. Okay, uterus with the help of Allis forceps, angle and Allis, and we start suturing. What we need for suturing? We need needle holder. Needle holder, how to identify? Very short blades. They have serration on the inner aspect, and they have sometimes groove also on the inner aspect to hold the suture material. How to hold the suture material? The suture material to be held at 2/3 and 1/3 part of the needle, curved needle, and tip of the needle holder, so that when you are working in the deep cavity, there is no dead space. Immediately you can work. While you are working with the needle holder, you have to rotate your wrist in the direction of the needle. So we start suturing. What you need with the needle holder and suturing? The forceps. Two types of forceps. One is a tooth forceps, another is a toothless forceps. These are short forceps and these are long forceps. Tooth forceps and toothless. Again, remember artery forceps for soft structures like peritoneum. So toothless forceps for soft structures. And Allis forceps for tough structures like skin and sheath. Tooth forceps are for tough structures for sheath and skin. Okay. So this helps you to suture the uterus. And then we start suturing the peritoneum, sheath, again with the help of needle holder and the forceps. And we take the skin sutures also. Usually for uterine closure we use, and for peritoneum and sheath also we use vicryl suture, and for skin we can use ethylone suture, nylon suture, or any other suture which is non-absorbable suture. Okay. Let us go over one other general instrument. This instrument is known as Cheetal's forceps. Very unique instrument. Have a look properly. The blades are curved, joint and long handles without catches. Second instrument without catches. One was scissor, second is Cheetal's forceps, and third is the Ovum forceps. Remember, Cheetal forceps are basically used to give sterile things from the drum to the operating surgeon or the operating field. We need to keep Cheetal forceps sterile. For this, I am non-sterile. I want to take sterile thing and give to the sterile environment. So I need to keep the Cheetal forceps also sterile. For that, we keep the Cheetal forceps in a Savlon bottle. It should remain inside the Savlon bottle till here, so that this part remain clean and sterile, and the Savlon has to be changed daily. Our next instruments are Sims speculum. This is the posterior vaginal wall retractor. It is used along with anterior vaginal wall retractor. We have to introduce the Sims speculum in a vertical position and then we rotate it transversely. There are different number of speculums are available. Suppose patient has not delivered, so the capacity of the vagina and so we use a small size speculum. If patient has delivered, vaginal capacity would be more, so we will be using more size, upper size of speculum. It has grooves to collect the discharge. Usually with these two instruments are used together. Retract the posterior vaginal wall, retract the anterior vaginal wall to visualize the cervix. Why do we need to expose the cervix and see? So in the OPD we want to examine the patient and see whether there is any cervical pathology. This can be a common question like cervical erosion, cervical polyp, any other infection, discharge from the cervix, or any other pathology like fibroid polyp or malignancy over cervix. So whenever you pick up this instrument in the exam, this much things you should know, that this is a non-self-retaining posterior vaginal wall retractor of different sizes used along with anterior vaginal wall retractor. This instrument, valsellum, usually we use it to hold the anterior lip of the cervix in procedures like insertion of copper T, then doing MTPs, DNE, DNC. In all these conditions we use. Remember not to use valsellum over a pregnant cervix. So whenever we want to do any surgery over pregnant cervix, we have to hold the pregnant cervix with Babcock forceps, which are non-injuring. These have teeth over it, so they injure. Pregnant cervix is very soft. Okay, so for os tightening we have to use Babcock's forceps. Okay, and any other procedure we can use anterior vaginal wall retractor. are going over the procedure of the D&E, I have a separate video for D&E also, you can check it out. These instruments are called dilators, Hagar's dilator. They have what? Numbers written or both sides. This side is different diameter, this side is different diameter. So usually we start with the smallest number of dilatation of the cervix and gradually we increase. Suppose you are doing medical termination of pregnancy of first trimester, you need to dilate one number more than the weeks of gestation, right? So 8 weeks pregnancy, you need to dilate up to 9 number dilator. This instrument is known as curette. First of all, see, there is a difference between anteovaginal wall retractor and the curette, right? Almost same length, but they have got fenestra here, and these two ends are smaller than anteovaginal wall retractor. It is a common mistake when you identify the instrument. The curette is having a blunt side and a sharp side. So blunt curette and sharp curette. We again hold it like this. We must have taken uterocervical length. So when we use it, we must not introduce it more than the uterocervical length to prevent the perforation of the uterus. First we use the blunt side and scrape all the sides of the uterus. Then we rotate and we scrape with the sharp curette. So this instrument is known as curette. One more instrument, see, again without catches, scissors, then Cheetal's forceps and Ovum forceps. These three do not have catches. Remember? Yes. How do we use? Where do we use? We use in a medical termination of pregnancy or in cases of incomplete abortion DNEs. Whenever products are more inside, we need to use the Ovum forceps. How do we use Ovum forceps? We introduce the Ovum forceps inside the uterus in a closed manner. Then we open, grab the tissue, we rotate and then come out. This prevents injury to the uterine wall, right? So this is a Ovum forceps. Remember, see, the blades are small, like a small bowl, and they have fenestra also. So this is a Ovum forceps. Do not confuse with the swab holding forceps. We'll go over other scissors which we have left. The one is a episiotomy scissor. Definitely by looking at it has different look than our routine scissors. How? The two blades have a different shape and they are curved. So these are episiotomy scissors. When we want to give episiotomy, what precaution we have to take, how to cut, and these questions will follow. What are the types of episiotomies? What complication can occur by giving episiotomy, like extension, injury to some. This instrument is a Babcock forceps. Babcock forceps blade are having a groove at the tip and it is non-injuring. It is different from the Allis forceps. Allis forceps do not have curved grooves and there are teeth at the tip. So they can injure. This will not injure. Babcock forceps are used to hold the tubular structures. Mainly you have to speak fallopian tubes first. Other structures are like ureter, bladder and appendix. The Babcock Babcock forceps, you will be asked the procedure for tubal ligation, the method of tubal ligation, Pomeroy method in detail, selection of the patient and complications of the tubal ligation procedure as a contraceptive. It is a permanent method. So these instruments are Babcock forceps and they are different from Allis forceps. These are the next instruments which are known as scissors. Metzenbaum scissors. They can be straight and curved, and tough scissors can also be there. These tough scissors are used to cut the tough structures, and these scissors can be used to cut the soft structures. Scissors do not have catches. Again, we hold the scissors with the same grip. The blades are small, sharp, small joint, and there are long handles in the scissors. These are the straight scissors used for suture cutting. These scissors are different than these scissors. These are episiotomy scissors. The blades are different than the Metzenbaum scissors. At the same time, both the blades are of different shape to accommodate the place where they have to cut, that the time of crowning the episiotomy given. With the episiotomy scissor, you are asked about the episiotomy. So you need to learn the types of episiotomy, when to give episiotomy, definition of crowning, which layers we cut with the episiotomy, how to suture the episiotomy and which suture material is used, and what are the complications of episiotomy. All these questions can be asked with the episiotomy scissors. They are very easy to identify. So if you are given a choice to take an instrument, do take episiotomy scissors. These are the cord cutting scissors. They have a small blade, rounded blade, and they are to accommodate the cord. They have a small joint and small handles also. So I am keeping all the scissors open. These are the Metzenbaum scissors, the stout scissors, straight scissors, curved scissors, cord cutting scissors, episiotomy scissors, and these are the suture cutting scissors having typical pointed blades and very small blades. So these are the suture cutting scissors. Have a look at all the scissors. They do not have catches.